one of the first steps in taking back control with chronic pain is understanding. And I just wanted to see if I could spark a little bit of curiosity, and that is the key word here. It is about understanding your pain. It is about actively asking questions. It is about seeking answers to your questions. A desire to know or learn something. That is the term, or that is the definition of curiosity. It's natural, it's intrinsic, it's motivational. It drives us to explore, discover, and understand the world around us. And whilst that is important for people out there living their lives, it is also important for people with medical conditions such as chronic pain. You have to question, you have to investigate, you have to understand what is going on and why. Pursue new knowledge. And remember, this is an important, the final sentence is an essential aspect of human development and learning, fostering creativity, problem solving, and intellectual growth. Well, the same thing applies to somebody suffering from chronic pain. It allows development, progress, and again, learning about you and your pain. It allows you to problem solve, a very important factor in self-managing chronic pain. And intellectual growth, again, just growth around your chronic pain. Why is it, I'm not going to answer these questions, I'm just going to pose questions to you, but why is it some pain leads to suffering? Why is it that some people enjoy pain? Some activities that might be painful bring pleasure. Some pain brings pleasure, other pain brings hell, other pain brings disability, suffering. Why does one person enjoy pain and another person not? Why does one person with phantom limb pain, why is that person allowed to have a completely normal life? Run marathons, break world records, whereas another person with phantom pain is wheelchair bound. I saw a person recently, exactly that scenario. So why is one person so different from the other with the same pain? Why does one person who's had a joint replacement have a completely normal response, live their life back on track, whereas another person that has had a joint replacement, has chronic neuropathic pain, is debilitated by the pain, is bedbound, is suffering, is not enjoying a good quality of life? Why is it that a person with scoliosis, again, mild scoliosis, terrible pain, terrible suffering, terrible functional problems, whereas another person with severe scoliosis living a completely normal life, productive in society? Why the difference? Why does somebody with a little bit of arthritis be debilitated by pain, and somebody with severe rampant arthritis, I'm using kind of descriptive words, I shouldn't, I need to be factual, but why does one person with severe arthritis have no dysfunction, no pain, normal quality of life, and of course the opposite? Why does somebody with a spot of endometriosis attend emergency departments over and over with severe pelvic pain? Non-manageable, non-responsive to therapies, whereas somebody else with high quantities of endometriosis in multiple locations, high concentrations of endometriosis, have a normal life. Why is one so different from the other? Why does somebody that have had a spinal fusion surgery for the correct reasons get on with their life? All good, moving forward, not looking back. I have a friend that had a similar treatment, and he's living a completely normal life, whereas another person that has a spinal fusion be completely debilitated, broken by the ongoing pain, and essentially non-functional. Why does somebody with a disc prolapse have such severe radicular pain, which is pain down a limb, that they can't get back to work? whereas somebody else has a steroid injection and they're fine. Why does one person respond to a steroid injection and another not? I've had people, again, friends and family, chronic pain affects a lot of us, where they've got severe disc prolapse and nothing is able to reduce the pain. Nothing is able to treat the pain. Even a surgery to take away the prolapsed disc, to remove it, a so-called microdiscectomy, is not enough to treat the pain. Why is it that some people with cervical spondylosis, degeneration within the neck, have no symptoms, no complaints, no problems, whereas somebody else with a couple of levels of degeneration are debilitated by the pain? Why are we so different? Why is one back pain so different from another back pain? And the answer is a complex answer, and this is the aim of some of these presentations, is to give you knowledge so that you understand what is going on in your body, because once you understand, it's not so scary. The brain is an amazing structure. There are 4 billion neurons and connections, I think, and I'm probably wrong on that number, but it is fascinating. So of course pain is going to be different, because there are so many factors that change my perception of pain compared to your perception of pain. There are so many pathways that interfere, that interpret, that relay signals of pain. Pain starts in my finger, travels up to my spine, is relayed from my spine to my brain, the base of the brain. It's then relayed from the base of the brain up to the cortex, the top of the brain. You assess what's going on, sometimes automatically, sometimes not. Relay signals back down to the body, down to the spinal cord. So it is fascinating. It really is fascinating. But unfortunately, people can be debilitated by chronic pain. This is a really important slide, and again, it'll be expanded on in another discussion. But the way you experience pain is completely different to the way you feel pain. So nociception and pain, which we will elaborate elsewhere. Nociception is the physiological process of relaying a signal of tissue damage from wherever that is occurring, your finger, to the spinal cord, from the spinal cord to the brain. Once it gets to the brain, you experience the pain, you feel the pain, you're affected by the pain. There are so many reasons why we feel pain differently. That is why somebody with a phantom pain might run a marathon and somebody else might be wheelchair bound. There is a context of what pain somebody's experiencing. So what is the context? On a war, on a battlefield, somebody is injured, compared to at work, where you're getting treated badly or bullied. So somebody is shot, they will pick themselves up, pick up a wounded colleague and run, whereas somebody sustains a small injury at work and they're debilitated. The context of what's going on is so important. Your past experience is so important. Your expectations are so important. Context. Your mood. Depression and pain go hand in hand. Does depression cause pain? Does pain cause depression? Do the chemicals that happen when you get depression trigger pain? Vice versa. Depression is important. Anxiety is important. Catastrophizing is so important around pain. Making mountains out of molehills. I am constantly feeling negative about my pain and what it's doing. Catastrophizing, again, we'll discuss that at another point. Chemicals, structure of the body is so important, and they make one person's back pain completely different to another person's back pain. The dopamine systems, the opioid systems, if you're taking opioids or not, natural endorphins, something called maladaptive plasticity, so the body reacts in one way, one person compared to another person. your cognitive set, so whether you're vigilant, whether you're attentive, whether you're able to be distracted by the pain, again, whether you catastrophize, which is what some of us are born to do. And I say this because I can tend to catastrophize at some point as well. So there are so many factors in your brain that affects the way you experience pain. The injury itself might be small, it might be large, that might affect things. There is amplification of nociception, so sensitization, which is the body's reaction to some forms of injuries. It might be genetics, it might be the injury. There may be so many factors that cause that amplification of pain that you're feeling. We could go on, and the aim really is to give you an idea about what is going on, to give you the ability to ask questions, to understand, why am I so different to him? Be curious about your pain, ask questions, ask your treaters, find information online, let us know what you're interested in hearing about, ask questions. It really is an important factor in getting on top of your pain, understanding your pain, and self-managing, getting back on track again.